Welcome to the online training for the Hawaii school-located influenza vaccination program, also known as Stop Flu at School. The following slides provide information to prepare staff for their roles and responsibilities at the clinics. Completion of this training and a passing score on the post-test are required for all Stop Flu at School personnel, prior to their participation in a clinic. Clinic personnel must pass the post-test with at least a 70% score. If a course participant does not pass within 3 attempts, then they will not be eligible to work at the clinics. If you experience any problems with this online training, please contact the help desk before attempting to complete the post-test 3 times. You can email schoolflu.helpdesk@doh.hawaii.gov. Or you can call 808-586-8300 or 1-800-933-4832, Monday through Friday from 7:45 a.m. to 4:30 p.m., excluding state holidays. Let's begin with some background information on influenza and the Hawaii Stop Flu at School program. Influenza disease and the complications resulting from influenza disease place a heavy burden on the healthcare system. Each year in the U.S., influenza disease results in millions of doctor visits and thousands of hospitalizations and deaths. The number of seasonal influenza-associated deaths varies from year to year because flu seasons are unpredictable and often fluctuate in length and severity. Children are a population who can easily catch and spread infections. Not only high-risk children are affected. Healthy children are also susceptible to flu infection, and in extreme cases, even death may occur. The table that you see here represents data from September 2010 to August 2011. During that time, 115 influenza-associated pediatric deaths were reported in the United States. A large percentage of them were 5 years and older, which includes the ages of those eligible for the Stop Flu at School program. Certain conditions put children at high risk for having severe complications from the flu, but even healthy children are at risk. Data here illustrates that nearly half of the 115 children that died from influenza in the specified time frame were previously healthy children without high-risk medical conditions. Flu doesn't only affect sick or high-risk kids. Healthy children also become very ill or even die from the flu. While no vaccine is 100% effective, the single best way to prevent influenza is to get vaccinated each year. Vaccinations not only protect the individual but may also prevent disease transmission to family members and to the community. Through the Stop Flu at School program, school children in Hawaii are being offered free flu vaccine. Here are some reasons why. 1. The State Department of Health believes that the Stop Flu at School program will greatly contribute to the health of Hawaii's school children, families, and communities. 2. School children generally have very high rates of influenza illness. 3. School children vaccinated against influenza have fewer illnesses, fewer absences from school, and lower rates of illness in their families during the flu season, compared with unvaccinated children. 4. Children are one of the most common sources of influenza transmission in the community. The Stop Flu at School program was launched statewide in 2007. Over 50,000 students are vaccinated through this statewide program each year. Flu vaccination clinics are held in participating schools statewide and will operate during normal school hours. Parental consent is required prior to vaccination. Only one clinic will be held per school, with the exception of multi-track schools. There will not be make-up clinics. If a student needs a second dose of flu vaccine, then that student will be referred to his or her doctor. The vaccination clinics will be managed using the Incident Command System, also referred to as ICS. ICS is a management concept that uses an expandable organizational structure to promote efficiency. ICS is used across the nation to manage emergency and non-emergency events. Two main principles of ICS are chain of command and unity of command. Chain of command is a top-down order of authority through which instructions are given and received. Unity of command is the principle that all staff report to and take assignments from only one supervisor. Clinic managers are the lead authority at every clinic. All clinic staff ultimately take orders from the clinic manager, either directly or indirectly through their immediate supervisor, such as a line flow group supervisor or vaccine group supervisor. Each clinic's organizational structure may vary, but every clinic will have a clinic manager to run operations. This slide includes a list of typical ICS supervisory positions at a clinic. Many of these positions will not be used if a clinic is small. Also, some titles may vary. Chain of command and unity of command will still apply, regardless of clinic size and use of the organizational structure. At Stop Flu at school clinics, the ICS incident commander is the clinic manager. Here is an illustration of a typical ICS command structure. The Stop Flu at school clinic staff may be organized differently, depending on various factors. Formal information and instruction come from the clinic manager and will be distributed downward, through the chain of command. Here is an example of a standard clinic setup. It may vary depending on clinic location and clinic size. Participants will arrive at the entrance and proceed to the registration station, where their consent form will be screened. If the form is complete and no contraindications exist, then the registration staff will direct each participant to the waiting area. The participant will then go to a vaccination station, where the vaccinator will administer the flu shot. Afterwards, each participant must wait 15 minutes in the holding area for observation, before exiting. Now let's review the vaccine and various forms used in the clinics. The traditional flu shot is also referred to as IIV. It contains inactivated or killed strains of the flu virus that are injected. The following individuals should not receive the flu shot: persons with a severe allergic reaction to eggs or to a component of any flu vaccine, persons with a severe allergic reaction to a previous dose of influenza vaccine, persons with a history of Guillain-Barré syndrome (GBS), and persons with a moderate or severe acute illness. The flu shot consent form is green. However, if the consent form has been completed online and printed out, it may be white or another color. Please pay special attention and screen all forms carefully. On this slide you can see an example of the flu shot form. The mandatory fields are circled in red. These include first and last name, date of birth, questions 1, 2, and 3, and signature, and date. The following video demonstrates the registration station staff reviewing a consent form for the flu shot.
On the flu shot form, check for first and last name and date of birth. Questions 1, 2, and 3 must be marked No, and the form must be signed and dated.
Pictured here is the student IIV online consent form. The IIV form has a syringe icon located in the bottom right corner. After receiving the vaccine, student participants must receive a notification form to take home to their parent or guardian, who can then provide it to their child's doctor so that the immunization record can be updated. If the child received the vaccine, then the vaccine type is indicated. However, if they brought a consent form to the clinic but did not receive the vaccine, then the reason for not receiving the vaccine is indicated instead. There are multiple roles and assignments to be filled by clinic staff, and each has different responsibilities, but there are some general duties that are the same for all staff. Please allow ample time for transportation, Parking and finding the clinic site. All staff must be in the clinic and ready to start their job on time. Those who are late repeatedly will be removed from the roster. All staff must sign in. Clinic staff will receive an action sheet that outlines a description of job duties. Read this and attend the just-in-time training provided at the clinic site. Just-in-time training will be a brief refresher of important information and updates immediately before clinic. Staff will assist with clinic setup and then perform job duties as assigned. When clinic has ended, staff will assist with breakdown. Before leaving, make sure to sign out. All staff are accounted for through the attendance sheets, so signing in and out is very important. While working at the clinic, please act professionally and courteously. Dress appropriately and wear covered shoes. Bring your ID. Cell phones and other electronic devices are not to be used during the clinic. Bring bottled water and/or snacks in the event that there is a break. However, eating and drinking are not permitted when the clinic is in operation. The following slides describe the roles and responsibilities of the screeners at the registration station and the line flow staff. Registration staff and line flow consultants report 30 minutes prior to clinic start time. Those who are fulfilling job duties of the registration station must check in with the clinic manager, sign in, receive job assignment and review job action sheet, obtain just-in-time training, and assist in clinic setup. Registration station duties include screening the consent forms for contraindications and completeness, providing the parent-guardian notification form, and directing participants to the waiting area. All registration staff should report any issues or apprehensive participants to the clinic manager through the chain of command. The registration station may have a group supervisor whose responsibilities include problem-solving with registration staff regarding incomplete or inappropriately completed consent forms, such as an obvious error in birth date. If further clarification on consent forms is needed, the group supervisor will verify with the clinic manager. The group supervisor will ensure that the registration station has enough supplies and will inform the logistics section chief or clinic manager if additional supplies are needed or if there are any issues regarding clinic personnel. Screeners at the registration station will match the name on the consent form with the participant to be vaccinated. Students must have name badges. If a student does not have a name badge, ask the teacher to verify the student's identity. Inform the group supervisor if students come to clinic without name badges. Screeners will review the consent forms for contraindications, accuracy, and completeness. They will check that the form is signed and dated. When screening the flu shot consent form, if questions 1, 2, and 3 are all marked no, and the form is signed and dated, then refer the participant to the vaccination station waiting area. If any question is marked yes or left blank, refer the participant to the group supervisor or the clinic manager. If the student reports that he or she has already received the vaccine or is not feeling well, refer the student to the group supervisor or the clinic manager. Each student will receive a notification form to give to their parent or guardian. It informs the parent or guardian that their child was or was not vaccinated. On this form, the screener will enter the student's name and the clinic date. The child will then take the form with them to the vaccination station. Line flow staff keep the clinic moving in a smooth and efficient manner. General line flow staff have the following responsibilities. They will direct participants to the vaccination station, they will monitor participants in the vaccination waiting areas, and they will maintain the flow of the clinic, which includes redirecting participants to the proper station if they are found wandering, investigating backups and taking corrective action, and consulting with the group supervisor or clinic manager as needed regarding flow and personnel issues. The line flow staff may have a group supervisor. This person's duties include the following: monitor staff stations and identify line flow issues, adjust line flow staff as needed, investigate backups and take corrective action, and consult with the section chief or clinic manager as needed regarding flow and personnel issues. The line flow group supervisor will also assist with directing participants to the proper stations and maintaining the flow of the clinic. After vaccination, participants must wait for 15 minutes in the observation area. Line flow personnel should be actively monitoring this area and watching for signs of an adverse reaction. Participants in the observation area must be seated. This will reduce injury if fainting occurs. If a participant experiences any adverse reaction, contact the group supervisor or clinic manager immediately. When the clinic is over, registration staff will assist in cleanup, including the packing of supplies. Please note that personnel who have not received bloodborne pathogen training will not handle any potentially infectious material, such as hazardous waste containers and syringes. Once the clinic has been returned to its original condition, staff must sign out. In most cases, someone will be designated to return supplies to the Department of Health. Whoever is assigned to return supplies and vaccines must do so in a timely and secure manner. The following slides describe the roles and responsibilities of vaccine administrators. Vaccine administrators, also referred to as vaccinators, must meet certain requirements. These include reviewing and understanding the standing orders for vaccine administration and the management of acute adverse reactions to vaccines. Vaccinators must be certified in CPR, must have received bloodborne pathogen training within the past 12 months, and must have experience in administering intramuscular injections to children within the past 12 months or completed a vaccine administration competency checklist. Vaccinators must have evidence of one of the following: proper immunization documentation of 3 valid hepatitis B vaccine doses, documentation of hepatitis B immunity by serological testing, or documentation of refusal of hepatitis B vaccination. Vaccine administrators must arrive 30 minutes prior to the clinic start time. Report to the clinic manager and sign in. You will receive your vaccinator identification code. You will document this ID code on the consent form after you vaccinate each participant. The clinic manager will assign vaccinators a specific assignment within the vaccination station. Review your job action sheet, and review and understand the standing orders before performing your job duties. The clinic manager will provide just-in-time training, and you will assist with clinic setup. The vaccination group may have an assigned supervisor or team leader. This person will oversee the vaccine administration area. This includes supplying vaccines to vaccination stations as needed, keeping the logistics section chief informed of supply levels and needs, maintaining the vaccine cold chain, and ensuring that the appropriate amount of vaccine, 10 doses, is drawn from each vial. The group supervisor will ensure that vaccinators are reviewing forms carefully and administering vaccine appropriately to participants. The vaccination group supervisor will inform the clinic manager if there are concerns regarding inappropriate vaccine administration. He or she will also ensure that hazardous materials are attended to and monitored by clinic staff and are not easily accessible to non-clinic personnel. All vaccinators must review, understand, and adhere to standing orders for administration of IV, and the management of acute adverse reactions to vaccines. Gloves must be worn if a vaccinator has open lesions on hands or if the vaccinator is likely to come into contact with potentially infectious body fluids. If gloves are worn, they must be changed between each patient. Remember that vaccinators must wash hands or use hand sanitizer between patients. If gloves are worn, remove them after each patient. Use hand sanitizer prior to putting on a new pair of gloves. All vaccinators must review each consent form before administering vaccine to ensure that no contraindications exist. One key to preventing serious adverse reactions to vaccines is screening for contraindications and precautions. Do not skip this step. Ensure that the participant is to receive the flu shot. Match the name on the consent form with the participant to be vaccinated. The flu shot or IV consent form has 3 questions. They must be answered no. If any question is answered yes or left blank, do not administer IV. Refer the participant to the group supervisor or clinic manager. Check that the consent form is signed and dated. If any contraindications exist, or the consent form is incomplete, do not administer vaccine. Refer the participant to the group supervisor or clinic manager. If a student reports that he or she has already received the vaccine, or is not feeling well, refer that student to the group supervisor or clinic manager. If no contraindications exist, and the form is signed and dated by the parent or guardian, administer IV following standing orders. IV is administered via intramuscular injection. Stretch the skin taut, and inject the needle at a 90-degree angle into the muscle tissue below the dermis and subcutaneous tissue. Before each vaccination, clean hands by washing or using hand sanitizer. Clean the administration site with an alcohol prep pad. Administer a 0.5 ml dose of IV vaccine, intramuscularly, into the deltoid muscle. Dispose of all vaccine vials and syringes into the sharps container. Document administration of IV on the consent form. When documenting administration of IV on the consent form, record the date and vaccination site. Use RA for right arm and LA for left arm. You may use pre-printed stickers that have the lot number, manufacturer, expiration date, and vaccine information statement or VIS publication date printed on them. Please make sure that the lot number and sticker match. Affix a sticker to the consent form and record your assigned vaccinator ID code.
Let's demonstrate the documentation process for the student flu shot form. Once vaccine administration is complete, record the date and indicate the vaccination site as either the left or right arm. Affix the pre-printed label onto the form. Once the label is applied, record your assigned vaccinator ID code.
After documenting IV administration, retain all consent forms. These must be collected and returned to the Department of Health. Complete the parent-guardian notification form and give it to the student. If the student did not receive the vaccine, indicate the reason on this form. If incentives such as stamps or stickers are available, then provide them to the students. Direct all participants to the holding area. They should remain seated there for 15 minutes for observation. The following slides will provide information about the management of acute adverse reactions to vaccine in a stop flu at school clinic. Personnel administering vaccines must be aware that recipients may experience an adverse reaction following immunization, which can be life-threatening. Personnel need to be prepared to recognize and respond immediately and appropriately. Localized reactions to a vaccine are generally the least severe and most frequent. They may include pain, swelling, and redness at the site of injection. This type of reaction generally occurs within a few hours of the injection and is usually mild and self-limited. Sometimes the patient will experience syncope, also known as fainting. To prevent falls in the clinic, assure that the participants sit down after vaccination and observe them for 15 minutes while they wait in the holding area. Here is a list of syncopal symptoms. It includes fright before vaccination, paleness, sweating, cold hands and feet, nausea, lightheadedness, dizziness, weakness, visual disturbances, loss of consciousness, and falling. If a participant experiences syncope, have them lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their pulse and respirations. Apply a cool, damp cloth to the patient's face and neck. If a patient falls, examine them to determine if an injury is present before attempting to move them. Place the patient flat on their back with feet elevated. If the patient loses consciousness, determine if an injury is present before attempting to move them, and place the person flat on their back with feet elevated. Call 911 if the person does not recover immediately, or if an injury is present. If syncope develops, the person should be observed until they are asymptomatic. An anaphylactic reaction is caused by an allergy to the vaccine or vaccine component. Though rare, it may be severe and life-threatening. Thorough screening of all consent forms is emphasized throughout this training so that the risk of an adverse reaction is minimized. An allergic reaction usually begins within minutes of vaccine administration, and it requires rapid recognition and treatment to prevent progression to cardiovascular collapse. Please review and be able to recognize the following signs and symptoms associated with anaphylaxis. These include hives, generalized itching, redness or flushing of the skin, swollen lips, face, throat, tongue and/or uvula, respiratory compromise, gastrointestinal tract symptoms, and cardiovascular signs, such as reduced blood pressure, syncope, cardiovascular collapse, and hypotonia. An emergency kit will be available at every clinic. It contains supplies and medications necessary to initially treat an individual who experiences an anaphylactic reaction. Kits will include epinephrine, diphenhydramine, syringes and needles, airways, blood pressure cuffs, stethoscopes, and other supplies. If a participant experiences an anaphylactic reaction at a clinic, notify the clinic manager. Assess the patient's airway, breathing, circulation, and level of consciousness. If symptoms are generalized, call 911 immediately. Place the patient in a recumbent position. Make sure the airway is clear. Perform CPR if necessary. Using the recommended dosage, administer epinephrine and diphenhydramine intramuscularly. To ensure an appropriate and timely response to an anaphylactic reaction, it is critical that you review and understand the standing orders before performing your job duties at a clinic. If an anaphylactic reaction occurs, epinephrine is the first-line treatment. Repeat dosage every 5 to 15 minutes or more frequently as necessary, for up to 3 doses, depending on the patient's response. Monitor the patient closely until EMS arrives. Record all vital signs and medications administered. Include time, dosage, response, name of the person who administered medication, and other relevant clinical information. All patients showing signs and symptoms of anaphylaxis, regardless of severity, should be referred to an appropriate medical facility for treatment. This concludes the slideshow presentation of the training program. If you have any questions, email schoolflu.helpdesk@doh.hawaii.gov or call 808-586-8300 or 1-800-933-4832.